Hello, this is Dr. Rhonda Johnson. Today is Sunday, January 15th, 2023. Today I'm presenting another point of view on the bivalent booster. Yesterday I offered the key points from Dr. Paul Offit's perspective article in the New England Journal of Medicine on January 11th, 2023. Well, today I'm sharing opinions of another expert, Dr. Eric Topol, who published his comments in his January 11th Ground Truth Substack series. I'll say from the beginning, folks, these two experts disagree. Well, Dr. Topol strongly argues that the bivalent vaccine is effective not only for seniors but for all adults. He cites studies done in laboratory settings, studies from Israel, and studies done by the CDC and published in the Morbidity and Mortality weekly reports. Then he talks about the bivalent vaccine detractors and naysayers. And he acknowledges that the FDA in the United States and the CDC, the government, made a big bet on the bivalent boosters when they purchased over 170 million doses. And he acknowledges that the uptake has been poor. He attributes this partly to pandemic fatigue, the delusion by the public that the pandemic is over, properties of the shots themselves, and another factor which he calls outpouring of detractors. Now, much to my surprise, he calls out Dr. Paul Offit by name and states that he has been staunchly against the boosters, and he said he negates much of the data recently and says that there's a lot more data recently that Dr. Paul Offit has chosen to disregard that show the clinical outcomes support the bivalent booster over the original booster. So there you have it, disagreement. Now, Dr. Topol acknowledges that the protection of the bivalent booster does not last long. It's likely to diminish over the course of 4 to 6 months, just like the other booster shots. And he also says we can't keep relying on frequent booster shots 2 to 3 times a year in the future, and calls for more variant-proof vaccine and new drugs developed to treat COVID beyond Paxlovid. Lastly, Dr. Eric Topol notes the virus isn't done evolving. It's talking to us and we're not listening, end of quote. And he says the bottom line is that he thinks the bivalent boosters work well to prevent COVID, severe COVID, as manifested by reduction of hospitalizations and deaths. So there you have it, folks. With this message, I've tried to bring different viewpoints from two prominent vaccine experts. What do I make out of all this? Well, this is my opinion when it comes to the health of the public. We rely on our scientists, researchers, and experts to look at all the evidence, evaluate new information as it becomes known, reach informed conclusions, and advise us as to whether we need to make a behavior change based upon what is known at the time. We're still very much in the midst of this pandemic. We need all of these experts to advance the knowledge base because the virus is not letting up. So I'll include the link to the article by Dr. Eric Topol in the comments. Please, I'm interested in your opinion. I know some of you all don't believe in vaccines at all, but for those that are following the science and the scientists, please feel free to leave your opinion and let me know what you think about this. Take care, folks, and be safe.